Welcome to Pawsitive Health, where we believe that pet owner education leads to better pet health. Just a quick disclaimer, any and all information in this video and in this channel in general should be used only for informational and educational purposes only. This should not be used for any specific diagnosis or treatment for your pet. Please contact your veterinarian for any specific pet health needs. Today, we'll be talking about heartworm. I'm joined here with my co-host, Devlin. My name is Dr. John Adam. Devlin, did you know that as of right now, August 3rd, 2026, there's over 1 million dogs and cats and other pets that have worms that are living in their lung vessels and their hearts. And unfortunately, this is a very preventable disease that those numbers are way too high because this is just such a bad disease, but such a preventable disease as well.
All right, so I'm going to be honest. I'm quite literally imagining like an earthworm inside a dog's heart right now, yeah. And I'm assuming that I'm entirely wrong. so you don't mean like actual worms, right?
No, yeah, dude, mean actual worms. These are worms, round worms. I guess they are kind of like a earthworm where they're round. They look obviously very different, but they can reach up to a foot long. The name of the worm is Diarfilaria. There we go, immitis. And the name is a little misleading. They do live in heart a little bit, but mainly in the lung vessels, and that's where they cause their most damage, is in the lung vessels and in lungs themselves. It is transmitted by mosquitoes and mosquitoes only. Yeah, that's what heartworms are.
Okay, so is it easy to tell that my dog or cat or pet has a heartworm?
Not necessarily. So as far as the life cycle goes, so what happens usually is you got a mosquito that flies by and starts feeding on an animal that's already infected, and they've got what they call microfilaria. And then they pick up these immature heartworms, and these immature heartworms develop into later stages up to the L3 stage. It usually takes about a couple weeks for that to happen. And then these mosquitoes will go and feed on to another animal, one that's not infected with heartworm, and transmit the larvae into the pet. That larvae then will begin migrating in the tissue of that animal. And while it's migrating, it is slowly maturing and growing into juveniles. Usually takes a few months there. And then they eventually reach the lung vessels and the right side of the heart as well. And that's when they turn into adults. And then from there, they'll be sexually mature, start developing new microfilaria that get released into the bloodstream. This whole process takes about 6 to 7 months. And unfortunately, there's no real big test that can determine that infection before the 6-7 month mark. Usually our testing is for the adult worms, specifically the female worms. And at least that's what our screening tests usually use. And so, unfortunately, we either detect these worms when we start having signs and symptoms because we have the worms, or when we're further along in the infection.
No, you said microfilaria. What? I'm assuming micro, small. So this is like when they're microscopic. Is that right? So what's microfilaria?
They're microscopic worms, the immature worms in the bloodstream, and so that's ones that get picked up by mosquitoes and develop into later stages of the larvae.
So are they passed like just blood to blood? Like, so like if I take my dog to the park, is it going to catch it from another dog at the park that has it?
They won't just catch it from them. Now, if a mosquito bites an infected animal, like I said, and then later on, it wouldn't be right away, obviously, but later on, usually a couple of weeks, if that same mosquito finds your dog in the dog park and bites your dog, then your dog is now infected.
So let's assume my dog got bit and infected on Valentine's Day. I still might not know that my dog has it today, August 3rd.
Yeah, I mean, you're getting to basically that point where you will potentially start seeing either signs or symptoms of it, or, like I said, being positive on a heartworm antigen test.
Worms got one up on us, dude.
Yeah, they do.
Man. Okay, so you said 1.1 million, but I mean, how common does that really translate to?
So let's go over the instance map that was just updated in April of 2026. So this year for us in this video, for the data that was pulled for 2025. Let me see if I can pull that up right now. There we go. So this is the 2025 heartworm instance. If you'll notice, obviously the hot spots are in the southern states. East Texas has been getting hit pretty hard recently. In fact, they're the number one state now. As you can see, there's a bunch of hotspots in that area. But what's kind of disturbing is that you can see this is starting to also be in areas in cooler, drier weather in the Midwest, and even up in the Northwest area. So every state in the continental U.S. has an area where we're seeing heartworm. There's not a state in the continental U.S. that doesn't have heartworm cases or significant heartworm cases. And these are, of course, only reported cases too. So it is kind of scary that this is spreading rapidly to not only the typical areas in the South, but everywhere else in the United States.
And Hawaii too, it looks like. Jeez.
Yeah, even Hawaii.
Wow. And that's crazy.
Yeah. And the reasons for that are a few factors. One is we have more wildlife reservoirs of heartworm, specifically the coyotes, foxes, wolves that are out there. They maintain the population, unfortunately, of the heartworms because they're not getting any treatment. Also, relocation of dogs. So we got dogs that are infected, we just don't know yet, getting relocated into places of low incidence. And then they, of course, start spraying heartworm because of the mosquitoes in the area. Also, we're having longer, warmer mosquito seasons. I don't know about you. I feel like I'm getting bit by mosquitoes all year around here in California.
Dude, I got bit like 3 times today.
Yeah. So, and it used to not be the case. I mean, mosquitoes, we got mosquitoes, but not as bad as it is nowadays. So I think we're just, a lot of these places are having mosquito problems more so than ever. And that, of course, is a bigger problem with heartworm with our pets. Another unfortunate thing, like I mentioned before, is owner compliance, especially in areas where people think that heartworm's not necessarily a big deal, which you can see in this map that it is a big deal in most of the states. And so if we just had good owner compliance with the heartworm control or heartworm preventatives, then we could lower these numbers significantly. And so we're hoping to educate clients as best we can to show them that heartworm is real, even in places like, Wisconsin, not Wisconsin, but Idaho and Washington and Oregon and California. I have a tough time convincing owners in Southern California. If you notice, there's a little hotspot down there in Southern California that we have. And once again, owner compliance is a big role in that.
That's crazy. Well, okay, so I'm assuming then, this is, I think we've talked about this, offline many times about, you reporting and getting this data and having to report it to these national agencies. I'm assuming all vets would have data on like just how prevalent it is in their area. And am I right?
Yeah. Majority of them do and everything. And asking them, about 60% say that rates have held steady, specifically in the southern states. 19% of clinics say that they've had an increase, and only about 10% of practitioners report that they have no cases. The majority have had some case of heartworm. I even have, where I am in Southern California, cases of heartworm. So it is more prevalent than it has been.
Wow. All right. So what's the first thing that you see when the dog comes in, the cat comes in, or because I'm assuming since you're trained to see it, honestly, you're probably going to notice before the owner does.
Not necessarily the case. The owners a lot of times will bring them in because of the symptoms or signs that they're seeing. They're thinking it's something else, and then we find out, unfortunately, that it's heartworm. The damage that is done is both mechanical and inflammatory. Worms can physically obstruct the vessels in the lung tissues as well as in the heart as well. They also will irritate and cause inflammation in the vessels and the lung tissue, and can cause thickening and inflammation and eventual hypertension or high pressures in the lung vessels as well. Once again, unfortunately, the early infections are silent with no signs or symptoms because you haven't had enough adult worm burden to cause any issues. But then they start developing things like persistent cough, exercise intolerance, or getting winded easy, fatigue even after normal activity, decreased appetite, even weight loss. Some dogs, they have such a high worm burden where it starts actually blocking the blood supply to the heart, and this can cause something called a Caval syndrome, where they just have a sudden onset of pale gums, collapse, maybe even dark colored urine, coffee colored urine. This is usually an emergency, and most of the time is fatal, and a lot of times we'll need surgical intervention to take care of. There's also a tag along with heartworm, a bacteria called Wolbachia. It's a bacteria that contributes to the inflammatory response to the worms, and so it is something we treat alongside treating the heartworm to help mitigate the inflammatory effects of the worms.
I got to be honest, bud, this is super depressing. I got to have some good news. Please tell me you have good news.
Well, once again, the good news is this is a very preventable disease. We have very, very good heartworm preventatives out there that, as long as we're compliant, I wouldn't say 100%. You can't never say 100%, but majority of times we can prevent this from. We just have to be very diligent with it.
Well, there's preventatives for fleas and ticks, and if I remember, heartworm is lumped in with the flea and tick one for a lot of those suppliers out there, right?
Yeah, there's a lot of combination flea preventatives with heartworm preventatives. There are standalone ones as well. There's oral ones, there's topical ones, there's even injectable ones, and so there's all types of preventatives depending on what is and the needs for the pet and the pet owner. And so there's not a lack of options, that's for sure.
Yeah. And since I can still get bit by a mosquito in the house, I'm assuming that my dog can still get bit, even if, he stays inside all the time. Is it only dogs that are getting it, or is it our other pets too?
Other pets as well, like you said, even our indoor cats and all that. Ferrets are also susceptible if anybody has a ferret out there. So with cats, it can be even trickier as far as diagnosing them and taking care of them. Cats are different as usual. They're always different. They're not a natural host. They're a dead-end host. And so what that means is that majority of the larvae don't make it to adulthood. So usually the worm burden is small, like maybe 1 to 3 worms. But those 1 to 3 worms can cause a lot of damage. Also, a lot of times they can have pure male worms, adult worms. They can have female worms that are not, sexually mature either. And so, because of that, since our tests, our antigen tests, test for a protein on the mature adult female worm, it can be very hard to detect an infection in a cat when we are suspicious of it. A lot of times we have to do other testing, such as an antibody test, potentially microfilaria testing, imaging like an echocardiogram. So we actually try to look for the worms in the heart or in the vessels. Sometimes x-rays to see if there's any secondary damage that we can see in the lungs or in the heart. Fortunately, with cats, one of the very first signs we see is sudden death, that they just die. And we find out, obviously, after a necropsy post-mortem that they had heartworm, which is obviously not what we want. And we're hoping to, once again, make sure they're on a good preventative so that we never get to that point.
Yeah. All right. So is there any treatment for the cats?
Unfortunately, for the adult worms, there is no safe treatment for cats. The treatment we usually use for dogs, melarsamine, is only, I wouldn't say safe, but it's something we can use in dogs that we can't use in cats. Usually in cats, we're giving them a preventative to kill the microfilaria and then prevent further infections. And then we just treat any signs or symptoms or inflammation, basically what we're seeing, until the adult worms that can live up to 2 to 3 years go away in the cat's vessels and heart.
Jeez. All right. So it's silent in dogs. For cats, it looks like asthma, or it just takes them off the board suddenly.
Yeah.
How do you catch it? How do you find it?
As far as testing goes, like I mentioned, the usual screening test that we do is the antigen test, which tests for a protein on the female adult worm. And usually we're doing the testing no earlier than 6 months of age because of that, because since you're not going to have any adult worms before 6 months of age, because of that life cycle, the testing will be negative, even though if you're infected with the heartworm. So usually we're testing about 6 months of age. If they have any lapse of heartworm prevention, usually we're restarting them and testing again at 6 months. Because once again, if they got infected during that lapse, it's going to take that time to have the adult worms to be tested positive. We can do microfilariae testing. Usually that's used alongside after we got a positive antigen test to confirm the diagnosis and see what the worm burden is or the microfilariae burden is. While a dog is on preventative, we even will test them at least once a year. And the reasons are a few things. Could be that we missed a dose. Could be that you gave your dog the heartworm control, but he spit it out or vomited it up somewhere in the backyard or behind the couch and you just didn't know. If it's a topical product, maybe it got washed off. So there's a lot of factors that we just need to make sure are covered by testing them so that we don't miss an infection. And another thing is that there are been reported resistant strains of heartworm, specific to the older heartworm controls that we need to make sure your pet is not having. So routine testing, even if they're on preventative, is key.
Yeah. Is this like with vaccines where, the more do it, the more you have like a herd immunity to it? Or is that not really going to help in this scenario? It's just you're helping your own pet and you're hoping everybody else is helping their own pet too.
I mean, you are helping as far as preventing, further transmission of the disease. I mean, if your dog had it, mosquito could have bitten your dog and taken that and is now infecting other dogs. So it definitely does help in general with a heartworm incidence. But the big thing is protecting your pet. I mean, you never want to see your pet go through having heartworm and being treated for heartworm. It's not an easy process at all. It can be very detrimental to them long term and potentially can be fatal.
Jeez. And you said there's some that are shown that are even resistant to like the preventatives.
Mm-hmm.
Is there something in the works for that, or is it just we're in kind of new and we don't know what's going on?
Yeah, I mean, our newer preventatives do a better job. I think it's more of the older preventatives that we're seeing some resistance to. Not saying that it won't happen with the newer ones, and so obviously we're going to have to keep striving to make better drugs to take care of these infections.
All right, and how much are these preventatives? It's the subject that's going to come up all the time.
Yeah, I mean, obviously it's going to be different in every clinic in every state and all that, but I mean, say you're spending $50 a month on a heartworm preventive. That's much cheaper than thousands and thousands of dollars spent if you're trying to treat having a heartworm infection. Also, is that $50 worth the pain and suffering your pet's going to have if they do get heartworm and eventually losing your pet? I mean, is it worth, skipping a meal a month and to take care of your pet? So,
yeah. Now you said it's different pricing for in the clinic, but I've seen heartworm preventative stuff, just at the markets and at the pet supply places. Is there stuff there that works?
I mean, so our typical heartworm preventatives are your what they call macrocyclic lactones. So things like the old ones would be like ivermectin, nobamycin, selamectin. Our new ones have moxidectin, and these are preventatives in the newer ones and the newer tools, like like a Simparica or NexGard combo, or I like there's an injectable one that you can do that lasts 12 months, which is very nice. It helps with compliance. What they do is they will kill the babies that are produced by the adult worms, and then from the mosquitoes and everything. So they will take care of those early stages, but if you get to the later stages, into the adult stages, these preventatives won't touch those. And so the only way to do that is via an treatment with an adulticide like melarsamine. So you have to make sure you're on those preventatives and being consistent with those preventatives so you don't get to the later stages of the heartworm disease.
Got it. And that melarsamine, or is that
melarsamine,
that is that like Capstar for fleas? It just works for heartworms like that?
No, it's not like Capstar. It's quite a process as far as treatment. It's usually a series of injections, a deep intramuscular injections. The drug will kill the heartworm adults, but that's when the problem is going to lie. So when we do treatment, a lot of times we are having strict confinement or exercise restriction, because once you're killing these adults, these dead adults can break up, dislodge, and throw into basically a thromboemboli, or a clog basically anywhere in your body, into your kidneys and your brain, into your lungs, and can cause obstruction of blood flow, inflammation, damage to those areas. And then the dead worms as well cause major inflammation, especially in the lungs, in the lung vessels, and that can turn into a lifelong scar tissue and inflammatory process in a dog or cat's lungs, and cause issues for the life of that pet.
All right. Mosquito repellents. Could we use that? I mean, mosquito repellent should be, if it's working, it should be sufficient to keep them away, right?
I mean, mosquito repellents are definitely a key player in helping with heartworm prevention. I would personally say you would also want to do a heartworm preventative on top of the mosquito repellent, because just in case, that one mosquito just comes in and breaks through and bites your animal, that ends up having the larvae in their body. Obviously, you don't want to risk that, but definitely mosquito repellents are very helpful in helping prevent heartworm as well.
All right. So let's say I've been using something like Simparica Trio, which I do. That one's a 3-month preventative. I go for the 3 months, and I'm like a week late to get to you. Am I in the danger zone within that week? The danger zone within the first couple of days, minutes? What's going on there?
Yeah, I mean, it's Simparica Trio. I think you're getting like a 3-pack, but each tablet lasts a month, so 30 days. But I mean, if you're off a few days or a week, you are potentially susceptible to the heartworm. So if that happens, please contact your veterinarian. Let them know. They'll probably have you restart immediately, and then have a test done in 6 to 7 months, because once again, we won't know if the lapse in treatment cause any issues until we potentially have adult worms, and that would be at 6 to 7 months.
All right. So for couple of practical tips for remembering all of this stuff? What do you got for us?
I mean, as far as for practical tips for giving the heartworm preventatives, just like your flea preventatives, I mean, put it on your calendar. That's a big thing. Set it on your phone. Set a reminder on your phone, whatever it may be. Make sure, obviously, when your dog takes the flea control, especially if it's oral, make sure they ingest all of it, and that they don't spit it out somewhere. If it's topical, make sure that you're applying it properly. You're spreading the hair and getting it directly on the skin, using multiple spots because you don't want to overload one spot. Try not to bathe them right after giving the topical treatment. Usually wait a couple of days to let it kind of sit and everything. So, and once again, if you do miss a dose, contact your veterinarian and get started back up immediately. So you're not caught being susceptible to the heartworm from a mosquito.
All right. And if, unfortunately it does happen and our dog or, whatever, tests positive and we're sitting in the room with you, what's about to happen? What's next?
So that's when we have a long discussion as far as treatment for your pets. Usually, if they haven't been on a heartworm preventative, we're getting back on a heartworm preventative so that we can prevent any further worm burden from a reinfection. We'll put them on a antibiotic called doxycycline that will take care of that bacteria, the Wolbachia, that can contribute to inflammatory symptoms from the heartworm disease. And then starting, like I said, that series of injections of the melarsamine if you're a dog, and potentially being hospitalized for some time to keep an eye on them. A lot of times we're putting them on steroids just to prevent any inflammatory response to the dead heartworms. Like I mentioned before, strict rest so that you're not throwing these dead heartworm parts into another organ and causing a thromboemboli or into your lungs as well. And it's a very costly procedure. Your pet may not make it through it as well, depending on how bad the worm burden is. And it's a very, very scary process. And unfortunately, in certain parts of the United States, some places deal with this almost every day. So it's, once again, much easier to convince, hopefully, owners to use the preventatives than to treat the heartworm.
I'm just trying to imagine how to take something like a border collie or a husky and stop them from exercising,
running around and going crazy. Yeah. And initially they might be feeling sick and everything. So, but if they start feeling a little better, then it's going to be very difficult to confine them and prevent them from running around. And obviously they don't know that they need to rest and relax. But it's hard. It's hard on them. It's hard on the owners. It's hard on the veterinarians. It's hard on everybody. So once again, I keep harping on it, but if people would just be good with their preventatives, a lot of this can be avoided.
Yeah. And then cost-wise, if we have to go down this rabbit hole, we're talking hundreds, thousands?
I mean, majority of places are going to be in the thousands. Obviously, every clinic is going to be different. But you're talking about the injection itself, doing testing and just monitor them, other medications needed to treat any secondary effects from the adult worms dying. blood work, like I said, other testing, potentially doing things like echocardiograms and x-rays, just routine blood work in general. It can get very, very costly. And once again, it's better to spend that $50 or whatever a month to take care of this rather than spending thousands on your pets that is going to go through a very tough process of this treatment, and it's going to go through some suffering. So, no matter how expensive this preventative is, it's worth it to make sure they don't go through that process. You don't go through that process either.
Yeah. And if you can't afford the thousands, are you just out of luck? Is there nothing else that you can do?
I mean, obviously we know that there are people that are not going to be able to do the gold standard in treating these heartworms, and there is alternatives. Is obviously not recommended. We always recommend the best treatment we can, but we understand that sometimes the best treatment can't be done. And so there are other protocols, such as keeping them on a heartworm preventative and just keeping an eye on them as the heartworm adults die over time, and just taking care of their symptoms and signs, and taking care of any secondary issues that happen because of the heartworm adults dying naturally. Once again, that's not ideal, but if we have to, that's the way we'll go.
Yeah. All right. Man. Okay. So, if they get it, is it a one and done thing, or is it something they could just keep getting over and over?
Yeah, I mean, obviously they can get it. That's why even after an infection, once we know they got infected, we'll have them on a preventative, and we'll keep them on a preventative, and we'll do that testing usually at 4 months and 9 months after being treated for the adult heartworms, and we keep them on that prevention the rest of their life, because they would probably already have some major damage from the first infection. Obviously, we don't want the risk as a second infection, and that definitely can happen. A mosquito can bite them again and transmit it again. So it absolutely is possible to get infections over again.
All right. I'm going to go through one bit. I'm just going to ask you some stuff, and you tell me if it's fact or if it's myth. I'm pretty sure I know the answer to quite a few of these. Heartworm is only in the South. Pretty sure we saw the map.
Yeah, so that's definitely not true. According to the map, I mean, it's in the majority of the continental U.S. and Hawaii too. Even Alaska wasn't a part of that map. I'm sure there's still instances there as well. It's just not in the data set, but it's in every state. So we do have to be careful no matter where you're at.
All right, it's a myth. Inside pets still totally fine, or still at risk?
Of course, indoor pets are at risk. I mean, you and I both know. I mean, just because we're inside doesn't mean we're not getting bit by mosquitoes. I mean, I wake up all the time with little ankle biters getting me, even in underneath the sheets in my bed. So, and they seem to love me. So, if I'm getting bit, then yeah, definitely my dogs or the cat are getting bit as well inside the house.
It's because you're so sweet, John.
Right.
All right. Can't skip preventative during the winter because they can get it all year round, because it's 6 to 7 months. I already know that one, right?
6 to 7 months, but also same thing as like in fleas, or not having as cold of winters anymore. There we got warmer winters, longer summers, and honestly, mosquitoes seem to be year round in a lot of places. So always have your prevention year round.
Another one, I would totally know if my dog was sick.
I mean, when they're sick, yes, you'll know when they're sick, but when they're sick, it's very far along and sometimes too late. So I'd rather have a preventative and never see those signs ever, and then to see the signs and know, oh crap, now I'm going to have to go through a lot of suffering with my pet and angst with my pet trying to treat them. But yeah, best to get it on a preventative than figure out that you need to treat for heartworm.
Yeah. All right. I mean, we pretty much did it. Just we'll end the way that we end, a lot of these. If somebody's watching and they have to do exactly one thing today, what is it? But I'm going to stop you because I'm pretty sure I know what it is. Talk to the vet and get on a preventative.
Absolutely. Please talk to your vet. Get on a prevention that is suited for your pet, and make sure to be diligent in giving it. If there is any lapses, please contact your veterinarian to formulate a plan to get them back on it, and usually have them tested again at 6 to 7 months. And don't give your vet flack for testing every year. There's a reason for it. We're just being cautious as best we can because there's obviously multiple factors that can cause lapses that you will never know. And we just want to make sure that we catch something early versus later on when it's too late.
All right. Fair enough. All right. Tell them where to find us.
So if you like this video and found it helpful, please like and subscribe to our channel. Also, if you like the contents of this video and would want more, we do have a school community. The link will be in the description below. Please join us. We have a 7-day free trial where you can come in and join like-minded pet owners in discussion of pet health, and join us for live Q&As with myself to go over questions on general pet health questions.
Sounds good. All right, man. We'll see you next time.
All right. And let us know if there's any other topics. Please comment below.
Bye, everybody.
Take care.